Welcome to Insights into Northeast Michigan, a WBKB News public affairs program. Insights deals with the issues affecting those within the community, as well as Northeast Michigan and the state. And now, Insights into Northeast Michigan.
Welcome to Insights. I'm Sherry Stewart. Today we're taking a look at a couple issues that remain in our news headlines. First, we'll take a look at sexual harassment in the workplace, and later we'll talk about the nation's reaction to the pandemic. Well, joining me first to kick off the conversation is Dr. Stephanie Bonis. She is the Assistant Professor in Criminal Justice at the University of New Haven. Thank you for spending time with us today, Dr. Bonis.
Absolutely. Thank you for having me.
And we're talking today, obviously, about some of the topics that have been trending in the headlines of late, and certainly sexual harassment in the workplace is one. And I know that you've done a lot of research into this topic. You call it gender crime. Can we just start there? And if you can just give us an explanation of what that is when you say gender crime.
I study crimes or violence that is directed based on gender. And so it's not just about violence against women, it's about crimes or violence or harassment that is originating because of someone's gender. So men and women can be recipients and men and women can be perpetrators.
And so when we get to talking about sexual harassment in the workplace, are we seeing more of it? Or is it just being reported at a higher level given platforms like social media? So what are your thoughts there?
That's a really great question. I think that we're seeing, I think that there has always been sexual harassment in the workplace. I think that it's very common. And in my own research, I study sexual harassment in the military. And we have seen these major events like the Navy tailhook event in the 90s, right? And then in the 1990s, there was also an event at Army Aberdeen, all the way continuing through, the Air Force Academy in 2003, all the way up until the Army in 2020. So we see these sort of sexual harassment instances happening all the time. And I think what's helping now get more of a critical mass of victims to come together is social media. So I think the coordination, in order to get it into the media, in order to get these instances to be widely covered, and in order to take legal action or even workplace action, you do often need a critical mass of voices. And what's happening here is we have social media is enabling some of those voices to be more coordinated.
Let's talk about your research into the military. Obviously, what did you come up with? What were some of the findings there? Some
of the findings in my research is that sexual harassment is extremely pervasive. And of course, I don't do quantitative work, I do qualitative work, but only 3 women out of 50 women that I spoke with said that they were pervasively sexually harassed. That means at multiple units throughout their military careers, whether that be 4 years or 20. And I found that one of the aspects of their harassment that women discussed often was how the military bureaucracy and administrative policies seem to be enabled to help harassers. And by that, I mean people who are harassing individuals in the military were actually able to use bureaucratic policies as a part of that harassment. So they were able to cite women for multiple infractions in order to build up a negative performance review of them. They were denied promotions. They were transferred into different units, or their qualifications were taken away from them. And ultimately, they were prevented from using the military sexual harassment policies in many instances. And so one of the points I always like to make is that you can have a lot of great policies and a lot of great, administrative responses to sexual harassment, but if the culture is enabling harassers instead of preventing them, people are not going to be able to access and use those policies. So it doesn't matter what those policies look like. You really need to get down to stopping harassment as it unfolds in interaction.
So if you're in the military and if these policies, although they may be on the books, but there isn't the culture in that environment so that you're able to exercise, say, your rights or to take advantage of those policies to help keep you safe, then how do service men and women, I guess, maneuver that situation?
That's a great question. I think there are a couple of options. One is that there are people who are working in the military there's a whole office dedicated to military sexual assault prevention. And that office could start tracking what I would call bureaucratic harassment. So they could start tracking who's getting more administrative separations, who's getting more non-judicial punishments, who's being the recipient of negative performance evaluation. Are there race patterns to that? Are there gender patterns to that? And then they could begin to see that, oh, this particular commander is using their power in the bureaucratic system to only, promote men or only promote white men. And so we could see that more systemically as a problem. What I mean by in interaction is if an individual is being victimized, the other people who are witnessing that often is happening in front of other people, right? So sexual comments or even groping, we saw that in the Cuomo case, are happening in front of others. If someone just says that they're not going to tolerate that, or hey, that's sexual harassment, or help stand up for the victim in those moments, we could see an erosion of that culture of harassment.
How willing, in your research, were people willing to share their experience?
A lot of people were willing to share with me their experience. A lot of people said that speaking in the interview setting was cathartic, but mostly because they were not able to speak about it when it was happening to them, or when they tried, they were often met with resistance. So in a couple of cases, one individual tried to report someone who was pervasively sexually harassing her and other women in the unit. And she was stopped completely from being able to do that by an individual who worked in an office of a higher ranking officer, who just called down to her major and said, hey, this person's trying to go around you, even though it's technically military policy that they're allowed to do that. She was completely stopped. And other people they ended up leaving the military as a result of the harassment because they didn't really think the institution would assist them.
Wow, those are some really troubling findings there. Dr. Bones, we want to continue our conversation. We want to take a quick break, but when we come back, we want to talk about your research in terms of how this may look outside of the military, and what are some of the steps that people can possibly take if they do find themselves being victimized in this way.
Absolutely. Thank you.
Insights will return after these messages.
Welcome back to Insights. We're continuing our conversation today with Dr. Stephanie Bones. She is the Assistant Professor in Criminal Justice at the University of New Haven. And we're continuing our conversation about sexual harassment in the workplace. As we were talking before the break, you've done an extensive amount of research on harassment in the military. But what about in the corporate setting? Do you have any findings there?
My research does not touch on the corporate setting, but I, of course, have read a lot of the literature that does discuss harassment in the corporate setting. And they find very similar things that I find in the military, that there is a sort of a hyper-masculine culture in a lot of organizations. I think all of their higher ranking people were white men. And so they created a culture of hyper-masculinity in that work environment. That news also broke last week. And we see in these workplaces that it can be quite difficult to report in those situations where there's an entire workplace organized around harassment.
Mm-hmm. Yeah, and one of the questions that I often hear is people try to dissect these cases, if you will, just discussing among their peers or family or friends. And the question seems to be often is, well, why did they, meaning the victim, wait so long to say something? So it seems a legitimate question, and you don't want to blame the victim, of course, but I often hear that. What are your thoughts on that?
I think that's a really important question, because in my own research in the military, and then also in the recent cases we've seen, individuals did come forward, but they were unable to get a satisfactory response either from HR or from the person that they reported to. So in Cuomo's office, one of the victims did report, and she was just transferred into a different position where she had less contact with the governor. In other instances, we see that reporting to HR does not mobilize sexual harassment policies, but actually then turns into trying to demote the victim, fire the victim, or in Cuomo's case, trying to smear the victim's name in the media. And so a lot of times, by the time we get to the point where we're seeing 11 victims coming together, or a critical mass of victims coming together in a lawsuit or a class action lawsuit, we are getting to the point where they've tried other avenues, and this is they just have so many stories that they can get that legal attention now.
I'm guessing there may not be necessarily a blueprint of what you should do if you find yourself in this particular situation, male or female, being harassed in the workplace. But what is your recommendation? Are you taking notes? Are you going to HR? Is there like I wouldn't say a 3-step plan to keep yourself safe, but what do you recommend, or what are HR departments telling people?
I mean, I think that if you ultimately want to get it documented and to take some sort of workplace or legal action, you need to create steps to ensure that you have the evidence to support those claims. Unfortunately, it will need documentation. So if you're being harassed over email, if there's ever an email message about it, save those emails, save text messages. And those are the best way. Even if you email someone to say, hey, I was sexually harassed by this person, or if you're telling someone about it over text message, save every instance of communication if that is something you're interested in pursuing. I would say overall, your individuals or safety is the most important. So try to reach out to anyone for support or help, including therapy or friends and family. But I would say ultimately it comes down to other people who are witnessing people being harassed. It's up to them to really stop harassment. And it should the burden shouldn't be on all on the victims.
Mm-hmm. Now, and before we go, Doctor, is there a certain, industry or a workplace culture that creates a more pervasive environment for this type of behavior to occur?
I think it can happen in any workplace. It just is a matter, and I think this is why the military is so interesting, is that in some military units where sexual harassment is tolerated, the quantitative data suggests sexual assault is more likely to occur in the units where harassment is tolerated. So we see a direct correlation between harassment and sexual assault, but we see that it can be broken down to the unit level. So in units where commanders don't tolerate harassment, there's less sexual assault. And that can be really, really important for when we think about, well, you can change a workplace, right? You can change the culture, and then you can have those policies actually be used the way that they're supposed to be used instead of being manipulated to be tools of harassment. They can actually help victims. So any workplace is susceptible. I would say that when it is a hyper-masculine environment, we're going to see more likely to be harassed. When it's dominated by men and a hyper-masculine environment, then you're going to see that more likely when there are only a few women in that space.
Okay, and before we let you go, I guess this would be the last question. What, in your mind, would you recommend as some good policies that HR departments and other companies can put in place so that if you do find yourself in this situation, that you know that there's a place, there's some type of recourse that you can rely on to get some type of action on your behalf? I
think that HR departments, that's a great question, should really try and implement every organization has these sexual harassment policies. They need to work towards implementing them. And then if they want to track, more subtle forms of harassment like bureaucratic harassment, they could start doing so, tracking the demographics of people who are fired or promoted or demoted or not, or who receive negative evaluations, sort of seeing if there are patterns to that, seeing if there are hiring patterns, right? If individuals who are hired are only, pretty young women in their 20s, right? There's probably a reason for that. And so sort of investigating those things can help track other forms of harassment as well.
So it sounds like keeping good data in terms of, as you're hiring and maybe perhaps promoting people and moving people. Sounds like what you really need to do is have some good data.
Mm-hmm. And also just in reminding people of their, that it's a non-harassment environment. So the more you say we don't tolerate sexual harassment, when someone makes a comment, then a victim would be more likely to come forward if they knew that they were often reminded that, oh, this is a place where we don't tolerate harassment. Whereas if you get one training and it's never spoken about again, someone makes a comment to you, you might say, oh, I don't know if this is reportable. But making sure that people know if people are making sexual advances in the workplace, or if they're saying lewd comments, to you, that should be reported behavior.
Oh, I think that's an excellent point to end on. Definitely making it known what your culture is and what you tolerate and don't tolerate in the workplace. I think that's really important. Excellent place to end it today. Great conversation, and thank you for the insight into your important research in this topic, Doctor. We really, absolutely, thank you for spending time with us today.
Of course. Have a good night.
You as well. And we'll have more of Insights right after this.
Insights will return after these messages. Welcome
welcome back to Insights. I'm joined for this last segment here with Dr. Anthony Santella. He is Professor of Health Administration and Policy at the University of New Haven. Dr. Santella, thank you for spending time with us today.
Thank you for having me.
And I know you've done significant research on pandemics, HIV research and all of that. And, you know, it seems like health issues, health things that we go through, pandemics, certainly seems like those would be things that would bring us together as a community. But this pandemic especially seems to have done the total opposite, that we are seemingly more divided than ever. What is your take on that?
Yeah, while one would think that, you know, in times of crisis, people and communities would come together to have a unified response, that's just not where we are right now. And while many would have cited the early days of the pandemic when we're still trying to figure out, you know, what works, what doesn't work, how to not overwhelm our health systems and providers, and how to roll out vaccine implementation were the most challenging days, I would argue that the most challenging period is right now. Because right now in the period we're in, we know that we have safe and effective vaccines that will prevent people from having moderate and severe disease, from hospitalization and death related to COVID. And yet we have a large segment of the population that remains vaccine hesitant and reluctant. And we also have really strong data that other public health mitigation strategies like masks and reducing indoor capacities and physical distancing works. It prevents the spread of transmission of this disease. And yet part of the country is compliant with it, and part of our friends and colleagues are not. And so how do we really address that and move beyond the pandemic? And while everyone has been burdened and is really just tired and fatigued of dealing with all things COVID, we remain in this place, this gray zone right now, where we're going to take 10 steps forward because we see success in the things that we're doing, and then take 10 steps backward because people remain uncompliant with the mitigation strategies. And that's frustrating for those who are compliant and who are doing the right thing. But until we either increase the vaccination rates substantially, where we have the majority of Americans fully dosed, fully vaccinated, we won't see the other side of this. And so that's going to make for a very challenging fall and winter when you add on the complexities of respiratory illnesses, cold, flu, and other things, and health systems that are burdened beyond belief.
Well, Doctor, is this setting a precedence, do you think, when we talk about other health issues? So, for example, we know just arbitrarily diabetes. It affects adolescents as well as adults. So does this pandemic. You know, everyone has been affected, various age groups. And so we don't see the pushback on things like diabetes, where many people are stricken with that, and it's debilitating. And so is this. So maybe that's not a fair comparison, but what is it specifically about this particular pandemic, the reaction that we're getting?
Yeah, that's a really great observation. What we see here is the politicizing of COVID and the vast circulation of myths and misinformation. You know, when we talked about other vaccine preventable illnesses like measles, mumps, rubella, meningitis, polio, people rolled up their sleeves. They did the right thing that was supported by science and public health. And now you have a fair amount of the population that are reading headlines, that are scrolling through social media, and they're basing their health behaviors and really the behaviors of those around them around myths and misinformation. And while local, state, and federal governmental agencies have done an okay job with combating those myths and misinformation, they were really focused on the rollout, right? Getting people vaccinated, making it easier, as opposed to addressing the misinformation myths using best practices that we know that work when it comes to people's health literacy.
Now, when you talk about best practices, say, certainly there's a lot of learnings that have come out of this, and certainly for health professionals and researchers like yourself. So what would you recommend for communities and government entities to get ahead of something like this in the future? Because obviously there is a lot of misinformation being circulated, a lot of it purposely, and some of it just plain ignorance, if you will. But what are some of the learnings in terms of getting ahead of something like this in the future?
Yeah, and so, you know, it's not a matter of if there will be another pandemic. It's a matter of when it happens. And I hope very deeply inside me that the next pandemic does not overlap with these dark days of COVID, because that is just like worst case scenario. But hopefully we have the time, and we meaning health providers, government officials, the media, to really sit back and reflect on what happened, the good and the bad and the ugly, and to take those lessons learned to the next pandemic. And so some things that could happen are, for example, using our large platforms, whether it's TV, radio, print, school systems, large employers. We have all these vehicles to reaching large groups of people to really break down what the disease is, what it's not, what works in terms of remedies and treatments and vaccines, and what doesn't. Because you can push out all the vaccines, you can have 1 billion doses of Pfizer, Moderna, J&J, whatever. But unless people really know why those vaccines are important, what they do, what they don't do, then they have no vested interest in just believing someone because they're a physician on TV. And so we have to just not assume that everyone's taken their high school or college biology class and they understand how immunology and virology and how biology works. Let's break it down. And like I said, we have the platforms to do it. We have ways of reaching people. It's just a matter of making it a priority and not waiting till we're deep down in the pandemic to do those kinds of things.
Yeah, and I think you make a good point, and I think we'll leave it here because many of the people that we're seeing on social media and on major networks, this is our first time seeing them. This is our first introduction to them. So to be fair, I mean, people could certainly have a question, well, why should I trust you? Why should I trust your science? So this definitely is a learning.
Yeah. Like I said, I really hope that, with everything, when big things happen, you need the time, the space, the resources to really reflect on it, document what you did well, fix the challenges when things didn't go well. Because like I said, this is going to happen again. It's just the world we live in with travel and our interactions with the environment and with animals. It's going to happen. So we just have to get used to it and embrace it, accept the uncertainty that comes with living through a pandemic, and do better next time.
Absolutely. Well, Dr. Santella, we want to thank you for spending time with us today and sharing your insight. Certainly, you have a vast amount of research, and we're grateful to be able to talk to you today and get some better insight in terms of why people are reacting the way they are during this pandemic. Thank you again, Doctor.
Thank you. Take care.
You too.
Bye-bye.
Well, that does it for this week's Insights. If you have a question, comment, or story idea, we'd love to hear from you. You can email us at news@wbkb11.com. I'm Sherry Stewart. Thank you for watching and have a great week.
Insights into Northeast Michigan is produced by WBKB News. This has been a production of Thunder Bay Broadcasting Corporation. All rights reserved.